International Modern Hospital Superheroes. Only on 105.4 Radio Spice. Full to Twisted.
Okay, we're going to interview. He's actually a VJ. He's Dr. VJ Sebastian, consultant cardiologist, IMH. Let's go. So I know you come with 30 years of experience and you've worked in so many countries. But now I'm going to ask you, who are you?
I'm Dr. Sebastian. I'm the consultant cardiologist, head of the Department of Cardiology, and I'm also the medical director of this hospital. I basically had my medical graduation from India, and subsequently I had training in England and United States. And I worked in England, worked in India, worked in Brunei for quite some time, and now in UAE for the last 12 years.
So Doctor, what is so special about the cardiology department in IMH?
The special thing about the cardiology department in IMH is we provide acute care as well as follow-up and routine care. When we say acute care, when a person gets heart attack, the most important thing is immediate care.
Okay.
And now all over the world, particularly advanced centers, we have to take the patient immediately to the cath lab. If the patient comes within an hour, 2 hours, 3 hours, we can actually take them to the cath lab and undo the block. So no damage done to the heart. So this is what. So we have a chest pain unit where anybody comes with a chest pain is attended, triaged, and immediately action taken. Within 30 minutes they reach the hospital. Within 15 minutes the patient is already in the cath lab, we open the block. So that is the best. If we can do it within an hour, within 2 hours, that gives the best result. So we are geared, we are ready, we are staffed for years.
So why UAE? Do you prefer UAE to a lot of other nations in terms of medical
No, what
infrastructure?
I felt working in each region is very educative. It's a great experience because regionally there are cultural differences, there are environmental differences, and a lot of differences in the disease pattern. So I think it's a fantastic experience to be. I had been in Southeast Asia, so I knew the common problems in Singapore, Malaysia, Brunei, Thailand, Indonesia, Philippines. So I had a lot of good experience and exposure to problems in that region. Now last 12 years I'm here, and I'm very glad that we have made a lot of progress during the last 12 years. Well, there are a lot of myths. I think people think that if you are slim and not overweight, you won't get heart attack, which is not true. Yeah. And sometimes women also have this false belief that they don't get heart attack. Women also get heart attack, but it's relatively at a later age. And when women get heart attack, they run into more problems, and their chances of dying is more.
And why is this?
The reason is usually the women get heart attack at a later age.
Okay.
That's one reason. And other reason is by chance they get more complications. They run into more complications. Somebody come with a palpitation, somebody come with a difficulty in breathing. We do all the tests, and all the tests are normal. At the end say, young lady, I couldn't find anything wrong. I wonder whether you have something worrying you, bugging you. And they come with their stories. Problem in the office, or problem at home, or problem in the neighborhood. A lot to learn in medicine.
Doctor, what are the symptoms that I should keep in mind that I know that maybe my heart is at a risk?
Yeah, I think you have to consider two things. Number one is you have to look at people who are likely to get heart attack. These are the people with high risk factors.
Okay.
The commonly recognized risk factors are family history, increasing age, male more than female.
Really?
Yep. And then comes all the modifiable. These ones we can't modify. You are born in a family, you are born as male, you are getting old, you can't get it.
So male hearts are generally
So
weak.
there are, it is not they are weak. I think they are put to a lot more tests than the female heart.
Doctor, you're saying that because you're a man.
But the most important thing is there are correctable, preventable or modifiable risk factors. like smoking,
Okay.
diabetes, high blood pressure, cholesterol, overweight, inactivity, stress. All these can affect or result in heart attack.
And all these things are very prevalent
They are
in
very
UAE.
prevalent here.
Yeah.
So in fact, what is happening here is we are getting more and more young people getting heart attack. When we were students or when we were trained, we never believed somebody below 50 can get a heart attack.
True.
Now the common persons who come with a heart attack are in their 30s, not even 40s.
My God.
So it is very worrying. This is a trend all over the world, more and more young people getting heart attack.
Doctor, how many cases have you handled till now in your 30 plus years?
That's a very interesting question. I think, I never thought, it was the first time somebody asked me, I think several thousand, because when I was in the government service in Brunei, we used to see something like 40 to 50 patients a day and almost every day. And same about in my previous job, I was in healthcare, I was very, very busy.
Usually doctors have this extremely boring image stuck to them, doctor hai. So even when I have a doctor come into the studios, it's like, Bhairavi, make sure your questions are just boring and straight and to the point. Don't joke with the doctor. But I see you like listening to music, time traveling, reading up, teaching children.
Yeah.
So you think this sort of makes you a better doctor?
Definitely,
Right?
definitely. I think what happens is interacting is very important. My patients, I think, appreciate whenever I sit down and talk about medicine and sometimes other things. I crack a joke with them and
Exactly.
things like that. Yeah.
Okay. Thank you, doctor.
Okay.
That was it.
I thought you were going to ask me what is the most embarrassing story in your life.
Do you have one?
I have one.
Please.
Oh. But maybe you don't have to hear.
No. Go on.
When I was in, this is the most embarrassing
Okay.
experience I had. When I was in Brunei, I was working initially as a physician.
Okay.
So there's an young couple referred to me by the gynecologist because they are married for 5 years, they never had children. So they asked me, would you just look at both of them and see whether there's any medical condition preventing these people getting pregnant. So when I examined and I found that this lady had thyroid deficiency. So I have treated her and one day I was doing rounds and then the clinic area, every clinic has got an office but there's a common area, there are hundreds of people sitting. So after my rounds I was entering my office, this young lady ran towards me, hugged me, kissed me and said, "Thank you doctor, I am pregnant now." And the whole people sitting there.
Whoopsie.
Really, whoop, what is this? For any heart-related issues, problems, you're always welcome to call me at International Modern Hospital. The number is 050-544-7990. That's my personal number.
Superheroes at International Modern Hospital, Bardubai. Call 04 406 3000.